All. This is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So today is our chit chat. My apologies, I'm a minute late. My computer actually crashed and I restarted it. I have a lot of things to discuss with you, just briefly, 5, 6 headings. And of course, we'll do our chit chat as well. So if you give me a few minutes, let me, breeze through some of the news that I think you would like. This is the agenda for today. We'll talk about Dr. Paul Marek, my Zoom calls, and Saturday morning walks, and a few things here. So let's actually start from this one. This gentleman here, his name is David Petrino, and he is from a department in Mount Sinai. And I'll show you his profile in a second. I discussed their study a few days ago, and that is about the long COVID and the immune profile, where him and his team was presenting what are the immune profiles of the long COVID patients, where you can say with 94% accuracy that this is long COVID. And so he is interviewing with another gentleman called, I think, named David Teller or something like that. And here I was listening to his interview. I have invited him for our channel as well. And I thought this was an interesting point. The host here asks David Petrino about the long COVID and the vaccine injury. So even before that, let me actually quickly show you the profile of David Petrino. So this is their study, Distinguishing Features of Long COVID Identified Through Immune Profiling. I actually discussed it a few days ago. It is the videos on the YouTube. This is David Petrino, Abilities Research Center, Icahn School of Medicine at Mount Sinai, New York City, New York. Department of Rehabilitation and Human Performance, and so on. So now let's listen in to what he's saying. So I know that the audio is always a problem. So I would just speak it out, and maybe we can have closed captions as well. So what he's saying is that we didn't believe patients when they say that we haven't felt right since we have vaccine. So they said that we have believed patients and we have engaged a similar research as they've done for long COVID. So, and he's saying that the study will be out soon or cases that would compare the long COVID profile and the vaccine injury profile. So their study is in this Nature, and it is interesting for me that slowly there is a acceptance of possibility of vaccine injury and the need to look at profiles there. At the same time, I believe that this is also an incorrect position to take, to always call long COVID as vaccine injury. That is also not true, because the spike protein, if that is the causative agent, then SARS-CoV-2 itself has the spike protein as well. So this is the first piece of information I wanted to convey to you, that there is this Mount Sinai Hospital associated researchers are working on vaccine injury as well. Now, let's go from some of the interesting news, then we'll do a chit chat as well. So this is Drbeen.com. In the description of this video, there is a link where you can get access to Drbeen.com. I had been saying in the January that our prices are going to change. So here are the prices, but you have a discounted price with the with that link. And again, these are medical lectures. So if you are interested in medical lectures, then I think Drbeen.com is an interesting one. Now, I want to look at this with us. First thing, and that is how levels of good cholesterol may increase dementia risk. So think about it for a second. Levels of good cholesterol, that is HDL, may increase dementia risk. So this is a study which was, so the study is, here is the study. It is printed in neurology.org, and I am so sick of the number of ads on this. It almost seems like not a journal. Low and high density lipoprotein cholesterol and dementia risk over 17 years of follow-up among members of a large healthcare plan. So these were Kaiser Permanente members. And this is that study. I'll do a deeper dive in this study, but generally what they found was that individuals who have HDL, the good cholesterol, within the normal range, they had the least possibility of developing dementia. But if their good cholesterol, HDL, was higher than normal range or lower than normal range, then the risk of dementia increased. Slightly, but increased. For example, here, higher and lower HDL-C values. I'm reading the blue one. Higher and lower HDL-C values were associated with elevated ADRD, dementia risk, or dementia disease risk compared to the middle quartile. HDL-C in the lowest quintile was associated with a hazard ratio of 1.07, so 7% increase. And HDL-C in the highest quartile was associated with a 1.15, 15% increase. And interestingly, LDL, the bad cholesterol, LDL-C was not associated with dementia risk overall, but statin use qualitatively modified this association. So statins use actually increased the risk of dementia when it was used with the increased LDL levels. So this is the, but here is an important thing. The study is done by Aaron Ferguson and his colleagues, or her colleagues, a doctoral student studying epidemiology at the University of California. So she's a student, or he's a student. I do not know if Aaron is man or woman. While the magnitude of this relationship is very small, it is important. The results show a correlation between HDL cholesterol and dementia, but not prove that low or high level of lipid directly cause dementia. So what levels? The average HDL cholesterol level in the study was 53.7 milligram per deciliter within the recommended range of 40 to 50. People whose cholesterol levels were strayed too far from these numbers were more likely to develop dementia over the course of the study. People whose levels were at least 65 milligram per deciliter, the highest of the three groups, were 15% more likely to develop dementia. Those with the lowest level, 11 to 41, had a 7% increased risk of compared to the middle group. The researchers didn't find any association between LDL and cholesterol. So this is the first thing that I wanted to discuss. I would do a deeper dive, but before we do a chit chat, some brief things. So this is one down. Then there's another important question, and that is, how does LDL cause atherosclerosis? And I wanted to show you two papers quickly. This is a paper from 1995 and 1996, the year when I graduated from medical school. This paper said that the reason that LDL are small, tiny particles, right? So these are small, tiny particles that have gotten lipids and stuff in them. Let's call them LDL. At that time, in 1995-96 time, we used to say that the LDL is able to get into a blood vessel. So imagine that this is inside the blood vessel, and we have endothelial cells. Endothelial cells are the surface cells. The thought was that LDL can just simply enter the damaged and inflamed blood vessel and just get under the blood vessel surface cells and cause atheroma or inflammation. However, here is another study. This is how bad cholesterol enters artery walls, April 24, 2019. So more recent studies have shown that LDL is actually actively carried by a protein from this cell outwards. So how does that happen? Imagine if I made endothelial cell. On the surface of the endothelial cell is a protein called SRB1. SRB1. This protein is supported by another protein inside the cell called DOC4. DOC4 enables the SRB1 to get onto the cell surface. SRB1 connects with the LDL particle, and once it binds with it, it actually gets into the cell. So the cell becomes, the surface becomes depressed, and now the SRB1 with LDL is in here. Then the surface closes, and we have a vesicle. We have a tiny thing that is now inside the cell. So LDL is in the cell. Then on the other side of the cell, this SRB1 comes back and attaches here and extrude the LDL out. So really our cell offers, just like a little ocean, it offers the LDL a carrier that traverses the LDL through the cell and under the blood vessel. So I wanted to make sure that we are aware of this as well, that it's not just the size and inflamed blood vessel, but there is active molecules that pick up the LDL and bring them to the vessel wall. Okay, then I wanted to share this as well. I think you'll kind of enjoy this one. Remember a few days ago we talked about LA Unified School District, who they still had the vaccine mandate, and they were firing teachers who were not vaccinated, while the mandates are actually lifted throughout the country. So they were sued by the teachers union plus another organization, and the district court had given or sided with the Unified School District to say that they have the mandate and will uphold it. I did a talk about it. Then that was appeal court, Ninth Circuit Court. Judges didn't seem very happy about this mandate going on. So here is the news that they have repealed the mandate. So before the court case continued, they have actually already voluntarily repealed it. And the voting was, I believe, 1-6. So 1% still believed that there should be vaccine mandates, and 6 of them said, no, we are done. So this was interesting as well, that LAUSD, so here, LAUSD scraps COVID vaccine mandate for employees. Their statement has been that this is nothing to do with anything outside, meaning court case. It is our own decision. We have decided that the risk benefit does not necessitate having a vaccine at this time. So then they said that, would you be giving the jobs back to those who were unvaccinated and you fired them? I think they were about 250. And they said, no, we will not take them back. However, if there are any open positions, they can apply there. So it's kind of anyways, that's what they've done. Then I also wanted to just very quickly share, in the context of the long COVID, there is this study. I have put the link in there as well. Give it a read too. This is the study of David Petrino. I discussed it. I'll discuss a little more as well. And now, Dr. Paul Marik. Dr. Paul Marik had a bad divorce. and he is in a huge lawyer bills. He is in financial stress. So with his approval, I set up a GoFundMe like thing, but it is on Give, Send, Go. And I'm going to put this link here. If any of you would like to support him, the link is here. Please feel free to. If you would not like to, that is fine as well. But he has been serving for a long time, and at this time, he needs our help. And then Patreon Mubin, and I'm not asking for support. We do 2 Zoom calls every Wednesday, one at 1 p.m. and the other one is at 6 p.m. Pacific time. It goes on about 1 to 2 hours, so about 2 hours worth of 2 Zoom sessions in which we actually do these kind of things that we're going to talk today. We do not record these Zoom sessions. So these are just free discussions. And I am more freely speaking as well because it's not a YouTube-like platform. It's a Zoom call. And similarly, the attendees can ask their questions and discuss more openly as well. So if you are interested in joining those Zoom calls, here is a link. You can, if you like, either YouTube member, which is I think $2, or Patreon, or Substack, whichever member you are. I post the Zoom links every week before Wednesday or on Wednesday, and we have these 2 Zoom sessions. Okay, so these are the quick things that I wanted to share. Now, how are you doing, and what do we do in our chit chat today? And if you have a question, please put some QQQ or something. And my request to you that if there are things that YouTube prohibit me from talking, we are at the YouTube platform, on the YouTube platform. So I just have to stay within their policies. If you want to talk something else, join me on Zoom and we can talk more. But here, just be aware that if I'm not answering your questions, either the question is, it doesn't make sense, or that question is something that is not very liked by YouTube. So Mean Bean says, what's up, Beans here? And Guy Telfer, you have been asking for the chit chat, so here it is. How is everyone doing? Old School is here. John is here. John says LDLs caused less inflammation in 1995 due to inflation caused by LDLs. Sure. Kim says, I haven't been here in a long while. I wish Dr. B would have made pictures to explain whole court situation. Absolutely. Did you see my little cartoon series that I made for mitochondria going on a vacation? Let me see if I can find it and show it again. It's in my artwork. Okay, so let's see. Okay, so I'm gonna share my screen again. This is a little cartoon I made. So here is the mitochondria talking with the nucleus saying, hey boss, I've been working without stop since my birth. I am exhausted. I need a break, boss. And the boss says, Mito, you've always been at power. You deserve a break. I am approving your vacation. So here is Mito on a vacation. My boss is awesome. Sipping some Coke. And here is back in the cell. And here is the funny thing. So of course the nucleus is saying, oh, or what have I done? And it was funny that there was a discussion under this. I posted it on YouTube. There was a discussion that somebody said, well, if the mitochondria is gone, then there is no energy. Then why is nucleus still talking? Isn't he dead? And I was laughing. I was cracking up that we're talking about a cartoon where nucleus and mitochondria speak to each other, and mitochondria go to a beach. So there, maybe nucleus can can be there for a few more minutes to say, oh, and then die. Miter dudes. Yes, miter dudes are mighty. Monica says, good morning. Good evening, Dr. Bean. Always learn so much from you. Thank you very much. And thank you very much for being here. So Mean Bean says, any thoughts on cancer and vaccines? Okay, so first of all, I haven't yet read any studies that show these turbo cancers that have been a term nowadays used. Because of that, for me to say they do it or say they do not do it will be an incorrect position, because I have to have the studies and data to be able to talk about it. Contemplating, I can give you my opinion, but that opinion can be simply discarded because it's just me thinking aloud. This is possible that vaccines, and that would be for SARS-CoV-2 as well, when there is heightened inflammation in our body, then of course there is a greater turnover of the cells. And if the inflammation is also causing cellular damage, then the possibility of creating a daughter cell that has cancerous tendency or has DNA damaged, or developing a cell which during the development did not have the checks and balances correctly executed, that is possible, and that can give rise to cancers. Carol says that 500 cases of tuberculosis in New York. New York, really? Is that because of the tuberculosis disease coming in? So for us, is this something to do with ethyroma, vitamin C? For us, are you saying that is vitamin C related to ethyroma? So vitamin C ideally should be helping to stabilize or reduce because it is anti-inflammatory. So let's see. Vitamin C, ethyroma, if there is any study. So check this out for us. This is vitamin C has been shown to reduce monocyte adhesion to endothelium. Adhesion of circulating monocyte to endothelial cells is one key in the formation of etheromas and is considered one of the early signs of the development of atherosclerosis. Additionally, vitamin C has been shown to improve nitric oxide production of the endothelium, which in turn increases vasodilatation, reducing blood pressure. Furthermore, vitamin C may prevent apoptosis of vascular smooth muscles, which helps keep the plaque more stable. And of course, vitamin C is an antioxidant as well. So very quickly for the folks here, so let's say this is an endothelial cell, another endothelial cell, and so on. What that paragraph said was that the vitamin C, and let's say this is inside of the blood vessel, this area. Vitamin C prevents or reduces the binding of monocytes. Let's say these are monocytes, inflammatory cells, right? So they will become macrophages when they enter the tissue. So here are monocytes, and here is vitamin C kind of interfering with their movement, reducing it. And if monocytes cannot get into the wall here, then they would not cause inflammation, and that would reduce the plaque. And then adhesion of the, secondly, vitamin C has been shown to improve nitric oxide production. So what happens is these endothelial cells, they produce nitric oxide, which diffuses out downwards or outwards, and the muscle cells, smooth muscle cells that are actually wrapping around the blood vessel like a cuff, and when they contract, they kind of constrict the blood vessel, or when they relax, they allow the blood vessel to open up and more blood flow to occur. So the vitamin C increases the nitric oxide production, which will cause the smooth muscles to open up and the blood flow to increase. So good question for us. So many comments have passed by. Okay, so Faraz says, I mean other mammals produce vitamin C. Do they get ethyroma? I think that they get ethyroma as well, but you'll have to look at their whole body habitus and their living habits. They probably do not eat the processed foods like we do. So it may be that they have less etheromas. John says, Linus Pauling would say, keep taking vitamin C. I would say the same as well following him. Parth says, you're looking fit, losing weight? Maybe. I'm trying to lose weight. So Mean Bean says, is reducing ultra-processed foods the best treatment for our health? If so, why isn't the CDC, FDA, Fauci, like folks promoting it? Number one, yes. Yesterday, what was it? There was something that my wife and I was talking, and we were talking about other countries and the kind of diseases they have versus the US. And she said that I was reading that some countries actually get surprised with the kind of diseases we have here. And I was saying that we have some processed foods here that are just too processed, and there is plastic in them, and there are more than 50 or 60 contaminants in them. So Dr. Barbara E. Corky, let me actually support my statement. So if you go to Dr. Barbara E. Corky Banting Award 2011. Here, in this one, and this is printed on American Heart Association Journal as well, Banting Lecture 2011. This award is given to someone who's done significant help in diabetes understanding or management or so on. So here, she talked about food agents. Here, check this out. I said 50. Food is different today than it was in the past. Over 4,000 new agents have entered our food supply intentionally or inadvertently. Almost none of those have been evaluated as a potential cause for obesity or diabetes. And then what she did was her team actually picked some of these environmental factors and looked at the behavior of our cells in their presence. And we found out, or she found out, hey, check this out, this is such an important thing. These factors, which she calls factor X, because it could be plastic, it could be something else, these factors cause inflammation in our body. That inflammation, when it occurs in the pancreatic cells, it causes the pancreatic cell to produce more insulin. More insulin, when produced without more glucose, because normally insulin is more because glucose is more, right? More insulin without more glucose causes a bombardment on the cells to say, take the glucose, whatever glucose is available. The cells say, you know what? You are asking us to take glucose. Well, there is not a lot of glucose present. So we just going to become resistant to you. We are not going to listen to you. Because if we took too much glucose from the blood, the person would have glucose levels fall below 80, and person can actually become unconscious or even die or develop brain damage and so on. So the cells say, time out, we're going to become resistant to you. So her and her team's work, for which she got this award, was that it is possibly the food processed, ultra processed food containing agents that may be colors, that may be preservatives, that may be other agents, or that may be just accidental entries because of the pesticides and the machines and whatever, which cause inflammation. So mean bean, great question. And yeah, this is one of the problems, the ultra processed food. Penny says, thoughts on Dr. Ryan Cole describes post-vaccine. What we are seeing is a drop in your killer T cells, in your CD8 cells. And what do CD8 cells do? They keep all other viruses in check. So number one, I have to look at the data to see how much drop and how long. I have actually presented a study in the past, which was actually coming from a vaccine company, Pfizer or Moderna, where here is what they had shown. Not this. Let me move away. What they showed was, and I remember it became a big scandal at that time. What they showed was that when you get, so let's say this is the normal T cells levels, and here is a vaccine injection, and the T cell after a few days, 3, 4, 5 days, the T cell levels are down. However, after a few days, these levels actually come back up. So the question is, what is this? So the scandal became that the vaccine is killing the T cells. That's not the case. And again, if there is more data that shows actually, and I should share my screen, that would be wonderful. So this is the screen. Let me go back for a second. So here is the normal T cells. Here is when the vaccine is taken. The T cell levels within a few days drop. Then they come back up as well. So this decline became a scandal, that why would a vaccine cause a decline of T cells? But that was actually just understandable because vaccine is causing inflammation, and the inflammation would consume the cells and the cell levels go down. It would have been more dangerous if the cell levels went down and stayed down. Then we could have said that, hey, vaccine has done something on the bone marrow to destroy the cells. Because if the T cell today got damaged, then they'll be produced again. If you see here, T cell life and production. T cell, about 98% of thymocyte die during the development process in the thymus by failing either positive selection or negative selection. So that's their training. Whereas the other 2% survive and leave the thymus to become mature immunocompetent cells. The thymus contributes fewer cells as the person ages. The thymus shrinks by 3%. But I should actually go back and just simply say T cell lifespan. The lifespan of a human memory T cell is the 30 to 160 days. In contrast to the typical half-life of a T cell, 8 to 15 years. These are memory cells. And otherwise, for a few days. So what are we talking about? What we're talking about is the following. Normally, we are producing, so let's say this is bone marrow. This is my depiction of bone marrow. I'm going to make eyes just to make it look cute. So this is the bone marrow. It is making T cells all the time. It is making B cells all the time as well. Then these cells go to thymus. T cells go to thymus and get trained. And then they would live only for a few days if they are not used. However, if they become used because there is an infection or something that activated them, then the active T cells can actually live for a longer period of time. Plus, when they become memory T cells, then they can live on for 3-4 years. And if they go and start living in the bone marrow, then they can live for decades. So I hope that answers that question. But still, the basic core of the question, I do not know. Dr. Ryan Cole is a good friend of mine. I do not know the data on which he is saying this. I have to look at that data to discuss this specific question. But in general, this is how the life of the T and B cells will be in any inflammation. Okay, so Mean Bean says, what are your thoughts with the safety studies of different vaccine processes of Pfizer and Moderna? So I think that there is at least something with bad batches. And there is also, I had done this discussion that at one point there was a factory or plant that was making contaminated vaccines, and FDA didn't even try to go and stop them or ask them to become better. So I think there can be a better process, and there has to be a better process given the amount of injuries. Now, the vaccine itself, the contaminants, the adjuvants, they all individually or combined could be causing injuries. So yes, the process has to be better. And the safety studies, I think, being in addition to this, their trial safety studies versus in production safety study, there is so much data. I think that there is a lot of eyes closing as well. I do not see, and tell me if I'm wrong, anybody who has more information, I do not see them actively collecting vaccine injury data and putting that in the risk benefit calculator to say, here is the risk benefit analysis of the latest state. I don't see that. So I don't think there is an interest in doing that. So John says, any new treatment with the FLCCC is looking into for long COVID and post-vaccine. So yes, funny that you ask. Dr. Paul Merrick and I have been discussing a little more nowadays because, number one, as I said, he has this financial stress, and I just call him to make sure that he's feeling okay and if there is anything he can share. Metformin is one that is going to enter the protocol, and there are more as well that they are. So Bronia says, any suggestions why long COVID causes feelings of pins and needles? So again, the discussions that we do here are just educational, no medical advice, no diagnosis. So I can just present a few educational or mechanistic reasons. So imagine that here is a piece of skin, right? And the skin has a few things underneath. Number one, there are nerves that are coming in, and they divide into branches, and they supply various parts of the skin, right? So these are collecting information, for example, pain, pressure, temperature, touch, movement, vibration, etc. So there are nerves attached to the skin. Then there are blood vessels that are coming in, bringing the blood to the skin, and then taking it away, right? And so this is also interesting. We all know this. For example, when people are blushing, why do their cheeks become red? Because there are blood vessels under the skin and they dilate. Or when we are in the hot weather, then the whole body starts becoming red. Why? Because the blood vessels under the skin, they start dilating. So there are blood vessels over here as well. Now, the possibilities of pins and needles in the context of vaccine or spike protein or general inflammation, first possibility is the nerve damage or nerve inflammation. And how can that happen? There are studies that say that there is a cluster of designation, I believe CD40, that can deposit on the nerves. It's an inflammatory mediator. It can deposit on the nerves, it can cause the immune reaction, and that would cause the nerve to become swollen. And when the nerve and the myelin sheath around the nerve become swollen, then what happens is paresthesias can occur. And what that means is that the nerve misfires. The inflamed area can just spuriously trigger an impulse, and that impulse will go back to your brain, and whatever this area of the skin is, and whatever the kind of impulse got, meaning the kind of nerve in which impulse got generated, the brain would feel that. That could be pins and needle, that could be pressure, that could be touch, that could be temperature, and so on. So this is one, that is paresthesia because of the nerve, where the myelin sheath or the nerve itself is getting damaged. So of course, for those kind of things, fish oil, and there are studies as well that can do a biopsy of the skin and they can take out the nerve. So this is small nerve neuropathy, and they can actually do a fine needle biopsy and then look at the nerves and see what kind of inflammation is around those nerves. That is one possibility. The other possibility is with the blood vessels. So imagine that if there is inflammation of the blood vessels, how can we have the inflammation of the blood vessel? Let's say there is spike protein in the blood vessels coming from SARS-CoV-2 or the vaccine and causing the blood vessels endothelial cells to become inflamed. And then not only the blood vessel is swollen and inflamed, but it is possible that within the blood vessel there are microclots that are forming as well. And we have done those discussions. And so what would happen is now the flow through this area is reduced. And so when there is abnormal flow, there could be ischemia, there can be tissue damage, the lactic acid is not getting removed with good enough speed, oxygen is not coming in, nutrition is not coming in, and that would also cause skin to not feel well. Similarly, there can be, and that not feeling well will be picked up by the nerves, and the nerves are the one that would say, hey, there's something going on. Similarly, these nerves themselves also have blood supply. So if there is a problem with the small blood vessels, then it is possible that the blood supply to the nerve itself is compromised. So nerve was actually okay, but because the blood supply is compromised, the nerve is misfiring. And that can also cause pins and needles. So there can be many reasons. There can be deposition of the immune mediators, there can be damage to the nerve, damage to the myelin sheath, blood supply issues, local lactic acid production. Let's say the mitochondria are damaged and the oxygen usage is not correct, lactic acid is more produced, ATP is less. That would also cause changes in the dynamics of this area. So I hope that helps. Okay, so Oleg says, what is your view on the possibility of plasmid DNA in the vaccine integrating into the recipient's genome and the consequences of that? So we have done this discussion many, many times. There was one study that came out of Sweden. I actually discussed that as well, where in vitro, that means not in the person or in even an animal, but in vitro, they had B cells that they modified, which picked up the vaccine, made the spike protein, and that spike protein came out as an exosome. And in that process, that showed how the vaccine generated mRNA could get into the nucleus. And many people criticized me, saying vaccine generated mRNA cannot get into the nucleus. And they are kind of wrong and right. They are right because mRNA stays in the cytoplasm of the cell. So here is a cell, and here is the nucleus. When mRNA is produced, it stays in the cytoplasm. Nucleus can actually produce mRNA, and then it can release it, and that comes out in the cytoplasm. It doesn't go back. However, it is possible that when a cell is replicating, when a cell is being formed, when it is dividing, at that time, just like, let's say, a home is being built, the walls are not high enough, the nuclear walls are being formed, they're not yet high enough, nuclear material is being formed. At this time, it is possible for the cytoplasmic contaminants to end up back in the nucleus. However, within the nucleus, there are enzymes that has a job of destroying foreign things. So the question that that team was able to produce artificial environment where they kind of force the mRNA to get into the nucleus was answered that is possible, but that was a lot of artificial environment. In a real environment, for a vaccine piece to become, the mRNA to become integrated into DNA, I have been saying it for 3 years, and I'll say it again 2 years or more, that's not possible. And if it was possible, we should be more scared of the adenovirus-based vaccines than mRNA vaccines, because the adenovirus-based vaccines have the complement DNA present in adenovirus. And so when this virus is injected, this virus's job is to actually go and connect with the hole or nucleopore. I just do not know how to draw the adenovirus correctly. Nucleopore on the nucleus, and the DNA has to be released in the nucleus, where this DNA that we injected from outside in the adenovirus platform will then give rise to mRNAs, which will then come out and make the spike proteins. So I sometimes get surprised that people just keep fixing on mRNA, that somehow mRNA would go in. But really, this platform of adenovirus, if we really have to be concerned that somehow this would become integrated with the nucleus and DNA, then adenovirus is more dangerous than this. But again, it's not seen. Good question. Guy Telfer says, are macrophages lymphocytes or bacterial? So macrophages are white blood cells, so they're not bacterial. So Rosemary, this is your warning to stop being so dramatic. If you have a message, you have given that message good enough. If you'll keep doing it, I'll block you. And Bell says, let's be scared. Why? RSS says, isn't vaccine an isopathic medical treatment? I do not know isopathic medical treatment will mean what. Can you elaborate? Embol says, don't rule it out with billions of people. Sure. With billions of, if you're saying that with billions of people, is there a possibility of some integration somewhere? Maybe. Meaning, I'm not saying it won't happen, but I'm also trying to figure out the mechanisms. And this mechanism of mRNA getting in and becoming integrated with DNA is more difficult than the actual DNA going onto the DNA nucleus and having a chance of doing that, or making mRNA in there. So, Guy Telfer, or the space fluid around the vessels compressing the vessels. Uh, Usually fluid that is present around the blood vessels. Um, so let's say this is a blood vessel, and there is extra amount of fluid, like edema or those, that has, we call it congestion. So extra fluid that has kind of accumulated here. In a normal healthy person, this extra fluid will be picked up by the lymphatic system and drained. This is the job of the lymphatic system. Lymphatic systems are big channels, like, fire hydrant, the fire hoses that you attach with the fire hydrant. So these are kind of collapsed pipes, but they are big enough that they would allow the water to rush out. Similarly, these the lymphatic channels are actually, if you put them in tissue, they are kind of a collapsed structure. But when there is fluids, they can then inflate and have that fluid go towards the lymph nodes. From there, they would eventually end up in thoracic duct-like structures and then go back to the blood system. However, if the lymphatics are also inflamed, the fluid coming in is more than that can be drained out through the lymphatic or through the venous system. Then that fluid would accumulate. That can compress here as well, but very few time there is a venous or arterial compression issues, even when there is an edema of the around the ankles and other places. But good mechanism. So, Sharuman, one important thing is I cannot give a medical advice or diagnose someone. I've had ME/CFS since 1993, when I was hit with 5 bronchitis infections in a year, then got glandular fever. I haven't been right since. Is there a new hope for us now as a long COVID is researched? Yes. So I definitely believe that part of the long COVID cohorts are ME/CFS patients as well. And so, yes, there is going to be a lot of possible therapies that would come out. Mary Macarena says, are the COVID after effects helping shed light on the importance of managing inflammatory conditions? Absolutely. So the importance of managing inflammatory condition was previously also evident. However, I did not see many doctors or providers specifically focusing on that. So if I can very quickly show you my teachings, if you go to videos on drbeen.com, there is a chronic inflammation. See here, chronic inflammation. I am actually putting together a list of lectures for inflammation. Now, if I go here and show chronic inflammation epidemiology, that how it is in the communities. Epidemiology. Chronic inflammatory diseases are the most significant causes of death in the world. The WHO ranks chronic diseases as the greatest threat to human health. The prevalence of diseases associated with chronic inflammation is anticipated to increase persistently for the next 30 years in the US. And I would say that with the COVID and vaccine injuries, this is going to just shoot up, and it has. In 2000, nearly 125 million Americans were living with chronic conditions, and 21% had more than one. In recent estimates by Rand Corporation, in 2014, nearly 60% of Americans had at least one chronic condition, 42% had more than one, and 12% had five or more. This is before pandemic. These numbers, 60% of Americans already were suffering with the chronic inflammatory conditions. I think it's going to jump very quickly because even the youngsters are now going to join this club. And I was the atherosclerosis and the LDL, vascular inflammatory diseases are more now. That would accelerate, in my opinion, the atherosclerosis formation or plaque expansion. That would in turn mean more cardiovascular diseases, more strokes, and so on. So this is, Mary, this is a very important question. And I feel that this would happen, that there will be more chronic inflammatory diseases. Boycott says, thank you for addressing chronic inflammation. I suffer Crohn's disease and I struggle with diet triggers. Yes, it is a difficult thing. So Rosemary says, you can block me or anyone, but I see it will not help. People asking for help on here cannot have it both ways. All right, thank you. Bye-bye. Okay. Carol says, thank you, you're very welcome. Jenny says, if you have fibromyalgia, ME/CFS, long COVID, have a sling biopsy done to look for small fiber neuropathy. They are thinking most fibromyalgia patients have it. Want to know right away, no chemicals at all. RSS says, I think isopathy is an offshoot of homeopathy. Interesting. I did not know this. My apologies. RSS says, treating a disease with the same virus or bacteria that causes the disease. I think setting up the immune system, I understand now isopathy, setting up the immune system to understand the infection, either via the vaccine or the infection itself, is understandable. But I don't think that we should, let's say, treat streptococcus with streptococcus. That just won't make sense. Okay, so my previous question was not about RNA integrating into the genome, but the contaminating SDMA linear doing so. So I have to see any study that, so let's say SDMA in vaccine. Minimal change. So I need to, Oleg, you'll have to give me some more data. So Farah says the parent technique suggests that underlying causes of ME/CFS is impaired function of the lymphatic and glymphatic system, which are responsible for the drainage. So the ME/CFS, let me parent pathology, ME/CFS. The parent technique is a biomechanical treatment consisting of lymphatic drainage, spinal and cranial osteopathy. Okay, so good question. Let me talk about it with mechanisms. So myeloencephalitis, chronic fatigue syndrome. We actually still do not know what is the actual pathology behind this. However, talking about lymphatic system, we know that, so this is a brain. My brain is always weird when I make it, so my apologies. It should be somewhere like this. And a little like this. Okay, anyways. So let's say this is the brain tissue. We know that the lymphatic system has a connection at the olfactory area, the roof of the nose. The nose need to be a little below. So roof of the nose, there is an ethmoid bone here, and the olfactory area is here. So there is lymphatic drainage from here, and then there is lymphatic drainage from the venous sinuses of the brain. When there is inflammation, and I have done this series of lectures for us, I think you may be aware of them, the sleeping brain and the lymphatic system. When there is congestion in the brain, that congestion does cause the neurons not to function correctly. And I had mentioned that before, that let's say here is the incoming fluids to the neuron. Here is a neuron. this is a neuron. And this is the outgoing fluid or fluid drainage system. What happens is when neurons are working, they produce, waste product. They produce trash. And the fluids that are coming in, their job is to wash it away. But if the fluid coming in is less, or if the trash is too much, or if the drainage system isn't working correctly, then this pile of trash would keep increasing. And the more the trash increases, the more disturbed the hemodynamics or the fluid dynamics will be, because the fluid is now bouncing around and not finding a way to get drained. And that just keeps aggravating the situation. So in that case, there are lots of neurological issues that are formed. And absolutely correct that for the lymphatic system issues, just the neck massages and the spinal pumps where you move your body front and back or side to side, or just the massages that would cause the milking of the lymphatic systems and the muscles, would actually move the waste products out of these tissues. Now, if I go to muscles as well, in my excitement of the discussion, I threw my pen away. So in the muscles as well, there are blood vessels that are bringing in nutrition. Then there are lymphatic channels as well that are washing away all of this. And if there is continuous inflammation in the system, then the problem is, imagine if the muscles are working with less oxygen, or let's say they are working with mitochondrial damage, which is very common for ME/CFS. So when the damage is there, mitochondria is not working correctly. Mitochondria makes 32 ATP, or mitochondrial involvement, to make energy. 32 ATPs are formed from one glucose molecule. But if the mitochondria is not working correctly, the cytoplasm of the cell, so let's say this is the nucleus, this is the cytoplasm. The cytoplasm of the cell is breaking down the glucose, and it would break it down to net 2 ATPs. So imagine you have a need for 100 ATPs, and you're only able to make 2 from one glucose molecules. You're going to need a lot of glucose molecules, 50. Now, every glucose molecule that is broken down in the cytosol, in the cytoplasm of the cell, that also makes lactic acid. So you can imagine that with mitochondrial help, lactic acid production will be less. Without mitochondrial help, lactic acid production will be more. Now, when the lactic acid is accumulating here, the muscle is going to hurt, just like it hurts after the exercises. And number 2, it will not be able to have proper flow of oxygen, because the blood flow is compromised when the mitochondria is not working correctly, because the nitric oxide production is not correct, because the electron transport chain complex number 4 is involved with the nitric oxide dynamics. The result is now the muscle is congested, it is filled with incorrect uh, toxins, and it is making a lot of lactic acid. So the patient is going to feel fatigued. So fatigue is because of neurological issues, and because of the muscular issues, and because of the neuromuscular junction as well. So there are many reasons for the fatigue. In such cases, massaging the muscles to move the lymphatics and to force the fluids out of the muscles actually makes the patient feel great, both for lymphatics, the brains, and for the bodies. The only thing is it does not recover the patient from the actual pathology, but it does give them some remedy. It does give them some level of comfort for a few hours or a day or two. So very good question and very important question. I do not know how far the comments have gone. Yes, of course, the red light therapy is very important. Morning walks are very important. Embol says, do you know anything about the 40 hertz red light therapy? So I have been 40 hertz. That's interesting. I did not know this. Recent studies in mouse model of Alzheimer's disease have shown that exposure to 40 hertz stroboscopic light, which is kind of pulsating, light through therapy for 1 hour a day resulted in slowing disease progression and led to multiple neuroprotective effects such as cognition and memory recovery. Very interesting. I have not read these studies. Thank you for bringing it up, Embol. I was not aware of it. Like compartment syndrome for lymphatics, yes. Yes. So I believe it strongly that patient of ME/CFS, the problem is the patient of ME/CFS has a lot that is going wrong. Neurological issues, so their psychological state, their motivation, and then their actual physical work with their body. The brain has to work with the body and move it. And so if the brain itself is not doing great, how would it really very efficiently move the body? Number one. Number two, the muscles themselves are now filled with the toxic substances, and the nerves are not doing good, and the lactic acid is produced there, and the mitochondria are not working correctly, and the patient is feeling pain because maybe the neuromuscular junctions are not working correctly, the neurotransmitters are not released, or there is inflammation of the neuromuscular junction, or there is inflammation of the nerves, or there is this lactic acid being produced because mitochondria are not working correctly. The result is patient doesn't move a lot because it is difficult for them to move. However, if they start getting massages, if they start doing the lymphatic massages, the spinal pumps, and if they start taking care of the mitochondria through infrared light therapies, etc., I think they would slowly start feeling better and move better. This is a very good question. Do you know that we actually do not have a very good idea for why yawning occurs? Good question. I do not know the right answer. There are many, many theories. Embal says, I have a playlist on dementia help if you're interested. Absolutely. Can you please share this, and I would share with the cool beans. Less oxygen. Yes. And it does provide much needed relief as well. Yes. That sounds like pulsing. Yes. Dr. Marek correctly recommends red light therapy. Embol, very, very correct. That mild exercise, the here is what needs to be done. Enough exercise or movement of the muscle that stretches them and contracts them sufficiently to put some pressure to move the fluids out. Even with hand, just doing these things will cause the fluids that are sitting in the muscles and are not able to get out because of the hemodynamic issues or the mitochondrial issues or the trash that has accumulated. Just helping the muscles, it doesn't take away the pathology, but it makes the patient feel much better. Trillium says, you're on a roll. Well, we are doing a chit chat after a long time. What else? Sherry says I just yawned because I heard that is called what is that, sympathetic? That we, if somebody yawns, then we all start yawning. To this is our psychological behavior in our limbic system, and this is how we tell the other person that, hey, we are with you. RSS says great explanation. Thank you very much. Dana says, I used to use a rolling pin for my fibromyalgia pain. Yes, the once you get the fluids out, the fluids also are trapping inflammatory mediators. They're trapping the inflammatory cells. There is lots of trash in there. So if the drugs are not helping, imagine if this area of the tissue is backed up and you're eating drugs, how easy will be for these drugs to reach everywhere in the tissue? It will be difficult because they'll get backed up as well. So you have to get the massages, and especially the head and neck area massages. That is very important. I remember one of my family members, I would not say who, because when I tell it, then people start talking about it would have been great if that member died. So one of my family member, after the vaccine injury, went to manicure, pedicure, and the person there did a head massage. And that person says that after the head massage, I felt like normal for a couple of days. And then they became the same way again, injured. So it is very important to move these fluids if somehow the body is not able to move them correctly and the drugs are not able to work on them correctly. Ultrasonic therapy is amazing, yes. So guy says I get full body syndrome like restless. So restless leg syndrome itself is a disease as well. But yes, it can happen to long COVID or vaccine injury or ME/CFS patients. And some of these temporary solutions really help. Faraz says, this is an Asian thing, Sarki Malish. Yes, Sarki Malish, yes. Susan says, Sarki Malish mean head massage. Susan says, wow, great info. Thank you. You're very welcome. Embal says, is there a lymphatic system is everywhere. All of our tissues have interstitial fluid. So if I can very quickly draw this, and I am so sorry I've taken so much of your time today. It's 1 hour, 15 minutes. Thank you for being here. Please don't forget to help Dr. Dr. Paul Marek. Join me on Patreon or this YouTube or on Substack and join these Zoom sessions that I do twice. These are the kind of discussions we do. Because my objective with those Zoom sessions is, can we stay healthy? And what are the ways, what are the things we must know to stay healthy? Now you tell me, just knowing that doing massage can actually help, even if it is temporarily, then if you're really feeling stressed or bad with the MECFS or inflammatory diseases of vaccine or long COVID, at least you know that you can become a little better by doing this. So join me, we can do these discussions. Now, going back to this question, M-Ball's question. So the way our body is constructed is we have something called basement membranes. Basement membranes are, imagine tiny layers of tissue papers, tissue papers, I mean it, tiny layers of tissue papers that we put. For every tissue, there is a basement membrane, just a sheet. And this sheet doesn't have cells in it. This is mostly fibers, collagen and fibrin and other things woven together to make a tight sheet. On top of this sheet sit our cells. They are kind of built on top of the sheet. This is why when our tissues get damaged, for example, let's say liver damage or kidney damage or lung damage, if the cell is damaged, but the basement membrane is fine, then the stem cells will be able to make more cells that would then get planted in the basement membrane, and the tissue would actually start functioning again. But if the basement membrane is destroyed, then scarring occurs, and that area is filled with cement, which is calcium and scar tissue, and that would not work correctly. Now, here are some cells, and there are some more cells, and more cells, and so on, right? So this is a sheet of cells. These cells are all sitting on top of the basement membrane. Now, between the cells, there are spaces, right? So these are the spaces between the cells or amongst the cells. Right? These spaces are filled with fluids. These spaces are called interstitial spaces. Interstitial spaces. Interstitial spaces are filled with fluid. And what happens is that our blood supply brings in more fluids, more nutrition, and takes away garbage from these fluids and the bad things. So this interstitial fluid is continuously recycled and refreshed. Just like if you say, hey, I'm going to go out and have some deep breaths, I need fresh air. The cells get fresh air by the blood supply moving and bringing in more nutrition and oxygen and taking away carbon dioxide and waste products. However, sometimes this interstitial fluid gets filled with broken cells or with viruses and bacteria and the fungi, or the immune inflammatory dead cells because there are a fight that occurred here. If that happens, those big chunks of the broken cells or the dead cells or the viruses and bacteria, they cannot be washed away by the blood vessels. So they have to be washed away by the bigger channels, which are called lymphatics. Lymphatics' job is to make sure that they get present in every single tissue, and they drain all those things that are not normally drainable through the blood vessels. Actually, when the lymphatics, for example, women who have breast cancer and their breast so the radical mastectomy occurs, the breast is removed and the lymph nodes are removed, they develop the edema of the arms because the fluid from the arms are not draining through the lymph nodes correctly or through the lymphatics correctly. So lymphatic failure, elephantitis, is an example where the lymphatics are not working because there is infection or the worms in the lymphatic channels. So lymphatics are very, very important, and they are present everywhere. M-Ball. Sorry, I had to draw so much and talk about it just to say yes. Trillium says, it is so good being with you, Dr. Bean. It means the world to all of us, Beaners. I am happy to be here. Thank you very much for being here with me. Stephanie, I can't give an advice like thing, because in cancers there is a fear of the cancer cells kind of moving and entering blood vessels or lymphatics and then going to the local lymph nodes and spreading from there. So moving the lymphatics could actually aggravate the situation. So I can't say that it is going to be a good thing. GJV says, thank you. You're very welcome. Mean Bean says, I need a good doctor like you. Thank you. Alima says, it's a joy to be here. Thank you very much. Becky says, I could listen to you all day long. Thank you. Sigrid says, we enjoy this time. So do you think that Thursday or Friday, we should just earmark that for chit chats? That would reduce the number. The thing is this, Dr. Bean has been under stress because I have been teaching here for 3 years, plus people have been complaining and trying to kill Dr. Bean. And so I have to focus there and make sure that we are, and you should get an access on Dr. Bean. The link is in the description. So I have just 2 days that I come in here. Wednesdays we do Zoom sessions. Do you want to have Thursday or Friday just for the chit chats, or normal teaching discussions that we do? Alima says, is there a chemical in berberine that causes the stool to turn red? That's a very good question. I had not heard of that. So berberine, red stool. Berberine can relax intestinal smooth muscle and prolong the residence time of intestinal content to fully digest and absorb the intestinal content to treat functional diarrhea. Um, I don't see it. I'll have to check that. Is it causing any bleeding, or it has something in it that causes it? If I said red stools, it says red stools caused by spicy, cheesy snack. So it may be something else, Alima. Be- beets. So for us says that it may be microbiome. I thought of that, but microbiota has so much change that it causes stools to be red. That doesn't. Yeah, I take berberine and I don't have red stools. Susan says I miss them too. Okay, so make a decision. Would you like to have a Thursday or Friday? We do this chit chat on Zoom every Wednesday twice. It only is $2 to $15. It's not expensive. It actually helps support my work as well. John says Thursday or Fridays. Do you need a hitman? They have already done so much damage. Kim says, look at the PubMed titles. Let's see. Love your drawings and excellent. Thank you very much. Elaine says it's been very helpful. You're very welcome. Nicholas says, thank you for breaking things down for everyone with a brain and working conscious. You're very welcome. Guy says, wouldn't this be similar to a tumor or RBCs flooding an area with a constricted efferent pathway? Yes, that would happen. Yes. Mean Bean, this is a very good question. So today's award for continuous good question goes to Mean Bean. I did that study a few days ago, which was it's on YouTube, which was abnormal bleeding after vaccination. The researchers had conjectures. They did not know the cause, and they said it that we do not know the cause of it, but it seems like that there is decidualization. So let me share my screen and talk about it. And there was a specific and important thing, and that was they said it happens more in women on hormonal replacement therapies. So let's say, right? So let's say this is uterus. It almost looks like I should just put a, so this is uterus, and uterine walls or endometrium will become thick every month once, and it would develop this spongy tissue which is very much supplied with blood vessels, because really it is a preparation for a zygote or a sperm and an ova that have met. So we have made a beautiful bed for this little 2-cell baby, and then it has to live there, and we're providing a lot of nutrition to it, and we are really taking care of it. So this process of developing this spongy thick layer which is rich with glands and blood supply is called decidua. And what they said was that women who are on hormone replacement therapy, they usually do have some decidua formed because of the effect of those hormones. And then vaccines, now here is an unknown. Vaccines are then causing this either increase, the decidualization is happening. So even if the layer was thin, vaccines is causing that to be increased. And they said that there was a number of people, I mean, they didn't write it this way, but there was the implication that probably it is the hypothalamo-hypophyseal pathway, meaning in our brain, women's brain, hypothalamus tells the pituitary to produce the hormones that are going to work on ovaries and on these areas to start making decidua. So there was a thought that vaccine is causing an issue here, which is then causing increased hormones, which is then causing decidualization, which is then sloughing off, causing bleeding. However, they said that in their study, they did not see much issues with the hormones themselves. And so they said this seems to be a direct effect on the uterine tissue. I would think the blood vessels of the uterus, a direct effect of spike protein on the uterine tissue. So this was their conjecture. They said our study has not taken the clinical data to be able to say what was the mechanism for this. Our study has simply proved that this happens. So Mean Bean, there is, at least from that study, there was not a clear reasoning for why this happens. Kim says, I like my anonymity through, so you can actually, okay, up to you. So very good question. John says, is the basement membrane the same as fascia? No, Fascia is something else. So if I go here, let's say a muscle. So muscle has its own cells, right? So muscle fibers, right? And those fibers, we want to make sure that these fibers are in a bundle. And there are multiple bundles of fibers, and there are multiple compartments. For example, leg has multiple compartments. There is a front compartment and lateral and medial and posterior. So what happens is fascia are bigger layers of tissue. Let me make it in black. Just like, wrappings, if you go for a grocery shopping and you have things that you put in one bag, let's say eggs and other delicate things go in one bag and the vegetables go in another bag and so on. Fascia is like those bags. It keeps the bigger macro structures in shape. Basement membrane is under the cells and is really, you could have multiple basement membranes with the cells and then they all wrapped in a fascia. So fascia is the compartmentalizing structures of our body. So let me see if I can actually fascia of the thigh. So here, look at this. So they have opened up the thigh, they removed the skin, and before you could see the muscles, you can see this shopping bag, this yellow layer covering the whole thing, and that is fascia. So it's not a basement membrane, it is just fascia. Then if you open the leg, so here they have cut the leg, the thigh, and you can see various muscle groups, and between the groups are fascia and their layers. So for example, this bundle of muscles are packed in one facial covering, this in another fascia covering, this in another fascia covering. So the fascia in the thigh, for example, let's say this is the bone femur, right? Now let's see if I can make a femur bone. Right, so let's say this is femur bone and we have cut the leg from below. So we are kind of seeing upwards, and the bone would have compartments of fascia projecting from it, which will break the muscles into various groups. So there is one group here of the muscles, there is another group here of the muscles, and now everything is black and nothing can be differentiated. Thank you so much for the diagram, Dr. Drbeen. So fascias are different from basement membrane. Trying to explain with this mess. Alima says, thank you, Doctor, for sharing your inexhaustible knowledge and wisdom. Thank you for cool beans for your comments and suggestions. You're very welcome. Second guess this. I don't want that bone marrow bone. Sure. I had cut it. So Mary says, are there any reports of the onset of seizures, even with clear MRI as vaccine injury, weeks and months after boosters, EEG completely normal? And I'll have to read it up. I think from a mechanistic point of view, it is possible if there is inflammation of the blood vessels and there is congestion, or if there is, neuronal inflammation, which would then cause misfiring. But I'll have to look it up, these studies. Yes. So, Mbal, this is a leading question. So, if you cut chicken, you may actually see the layers of the membranes wrapping around the muscles. Those are fascias. That is true. That piece of wrapping will be fascia. You betcha says every other week for chat is a good idea. Okay. Yes. Good night. You betcha. Sparrow says, I've been dealing with this for 2 years. This is still a problem for me after 2 years since. So the unfortunate part is that many of the doctors are not fully aware of how to managing it. And unfortunately, many doctors, mainstream good doctors, refuse to study the studies that come out for vaccine injury. And they should. Just like we studied the vaccine's mechanisms and the benefits and the dosage and everything, similarly we should understand what are the side effects of them as well. That is how any drug should be discussed. Drugs, vaccine, or intervention. I'm actually going to very quickly open up my Kindle to show you one of the book and how that handles it. For me, this is actually surprising. Let me actually open something and then. So here, this book is Goodman Gilman. So Goodman and Gilman's pharmacological basis of therapeutics. So people who are in healthcare or pharmacology, they would actually know that this is such a beautiful book. And I was showing this during our Zoom sessions, that for any drug, for example, here we are looking at some, I believe, muscarinic agonists. These are muscarinic receptor agonists, a group of drugs. Look at the way the drug is presented, or drugs of this group. Number one, they introduce them, then they say, here are various drugs in this category. Then they have already talked about their mechanisms. They give some more idea about the mechanisms. Then they differentiate between them, that what has what, and so on. Then they talk about the history and sources. Then they talk about absorption, distribution. I hate this. One second. Absorption, distribution, metabolism, and excretion. So for every drug, these are the dynamics of the drug, that how is it absorbed? Can it be absorbed from the intestine, or does it have to be under the tongue, or does it have to be inhaled, or does it have to be injected, or suppository, or whatever is the path, under the skin and subcutaneous. So absorption is to be known. Then distribution, that once the drug is given, where does it go in the body? That is called distribution. Then metabolism, that how does the body break it down to eliminate that, or activate or inactivate it. And then excretion, how does the body remove it? Does it go out through urine or fecal or air, inhalation or sweat? What are the pathways through which it can actually get out? Then for every drug, these are the therapeutic uses, or we call them indications, that when do you use it for various ones of them. Then you would see that there will be contraindications, precautions, and adverse effects. That here are the reasons why this drug should not be used. Here are the people in which this drug should not be used. Here are the precautions. Be aware of the following things. And here are the adverse effects. It is part of discussing a drug. Then not only we stop there, then we do toxicology of the drug. We say, well, if this drug is given in too much of a dose, or incorrect path, or a person who was not ready to be able to take this, then what kind of poisoning can occur? Then what is a solution for that poisoning? All this We study in pharmacology, every one of us in medicine. So we should be familiar with the idea, even in cases of vaccine, to say what is the vaccine's history, how is it formed, what is its mechanism of action, what are the risks and benefits, what are the indications, what are the contraindications, what are the adverse effects, how does it move in our body, what is the absorption, distribution, metabolism, and excretion, and what are the toxic effects, and what do we do with those toxic effects. This is normal. But what has happened because of these weird propagandas by CDCs and FDAs, the mainstream doctors have become very, very much reserved to even give it a chance to look at vaccine related side effects. And a person like me who has talked about the vaccines, the mechanisms of the vaccines, the benefits of the vaccines, the trials of the vaccines, then when it started being given, then the side effects of the vaccines, the toxicities of the vaccines, and then how do we try to fix them or handle them. When I used to teach about how vaccines work, I used to be called vaccine pusher. You would still see sometimes people leaving a comment, isn't this the guy who used to be vaccine pusher? Well, I'm a medical doctor who has been teaching how these products work. Nowadays, there are comments, isn't this the guy who's an anti-vaccine guy? No, the vaccine studies are coming out. Of course, the side effects would come out when these have been delivered. And those side effects we should know as doctors. And then we should know how to manage them. This curiosity has to be for everyone. And the mainstream doctors are not doing it. I think they're afraid that if they look into it, they will be called anti-vaxxers. Or if they look into it, they might actually become aware of the vaccine problems and see how to manage them. And they just want to stick with the protocols, whatever is the reason. This is why patients are suffering for a long time. And this is why I played this little soundbite from David Petrino, and I would play it once again for you. The question was, is long COVID only long COVID, or vaccine injury can occur as well? And he's from Mount Sinai, New York, and listen to his answer. We Did you hear? He said, we would acknowledge very plainly that vaccine injury is real. We are seeing cases of vaccine injury. Just like long COVID, who will we be if we didn't believe patients when they tell us that they haven't felt right since they took the vaccine? Yes. Vaccine of one sort or another. Then he goes on to say that we are actually doing another study or a case series on vaccine injured patients. So for me, it is kind of tragic to see us all divided into political groups and associated with medicine. Republicans have a different take on medicine, as if the medicine changes if your belief in being Republican or Democrat changes. Democrats have a different take on medicine, and they fight in those two groups. And for a medical person, they have to forget about Republican or Democrat or mask or anti-mask or vaccine or anti-vaccine. They have to understand what is a product, how is that intervention done, what are the data points for it to be indicated, who is it good for, who it is not good for, what are the benefits, what are the risks, what are the side effects, what is the toxicology, and how do we treat the toxicology. This has to be known by every doctor. But this and the punishment is severe. For example, I was punished when I used to teach about vaccines, and there were people complaining all the time. I am punished nowadays when I talk about the side effects, and these are mainstream studies. So I just talked about David Petrino. He is mainstream. He's in Mount Sinai. So now I am called other ways names. It's just so strange. Shadowman says, do you see problems arising in the future of many of those who have taken the COVID vaccine and boosters? So look, this idea that somehow the cells have become modified, and then 3 years later the infection would occur, and then that would cause the immune system to attack our own cells and kill us, and we have gotten modified cells that are expressing spike proteins all over. This was one of the doctors, which is very popular. This was wrong. There are many people who are going on. At the same time, there are many people who developed vascular problems, which then turned into strokes and cardiac events. That is also known now. So I think that the guarantee of 5 years, 10 years, I remember when vaccines came out, when SARS-CoV-2 came out, we had done this discussion that those people who had SARS-CoV-1, 10 years later, the incidence of diabetes was more in them compared to their age group who didn't have the SARS-CoV-1. So spike protein does something to our body and possibly causes inflammation, which most of us now know, which can then accelerate other diseases that occur because of inflammation. So will we develop more diabetes faster? I think so. Will we have more accelerated atherosclerosis? Possible. Would we then develop cardiac issues or strokes? Possible. And this is going to be spike. And if that is spike, then it is going to be virus or the vaccine or the vaccine. And interestingly, I think this is also clear to all of us. It doesn't happen to every single person. It happens to some. It's authorizing thalidomide for everyone. Correct. So I remember my first set of people calling me names and being angry was when I talked about the CHAdOX1, the adenovirus-based Oxford vaccine, which is the AstraZeneca and the Oxford. When I said that there are women who are developing clotting, and that study, the very first study, I think it was January or February, some very early time in 21, the vaccines had just started rolling out. And this study came from Germany. And I presented that study. You can actually go and watch those videos. They're there. And I presented that study and I said, if the clotting is occurring, here are the things that we need to do. And here is what the researchers think the mechanism may be. And that was the first time I got punished for talking about it. I thought this was medical talking. That the kind of things that were said. For example, I was said that, hey, you somehow are originally from Pakistan. And because AstraZeneca is India or Indian company, that is why you hate it. Then another group of people said that because the Oxford has invented this vaccine and we have not the best appearance with Germany, and this is a study coming from Germany to discredit us, that is why you are behind. So it was just immediately made political. And that, to some extent, I don't blame people, because medical community should be aware of making and knowing all of these things. General public has become so polarized by incorrect messengers, false messengers, that they actually do not know, majority of them, that this all is just part of understanding medicine. Anyways, we were having a very happy talk and it went into a different direction. My apologies. 7:51, almost 2 hours. So Joseph says, but side effects can be worse than the cure. It is possible. For example, the risk benefit analysis at this time is very different. And then continuous booster taking, when booster is just, I was, for FLCCC, I recorded a video about metformin and the long COVID incidence. And this is a study, a mainstream study by there are actually 5 or 6 universities from US, medical universities and hospitals, whose researchers have been working on that study. That study said, if you start metformin within 3 days of developing COVID symptoms, then the chances of hospitalization are reduced by 42.3%, and chances of long COVID are reduced by 41%. In people who do not start metformin, we're talking about the diabetes drug, metformin, within 3 days, the long COVID incidence in them was about 10%, 10.1 or 2%. But if they are put on metformin, the incidence of long COVID is 6.2 or 3%. And then they had another paragraph where they said those who had 1 dose of vaccine, they also developed 6.3%. So it was the same as 15 days of metformin use. Now, metformin can be given to pregnant women. It can be given to lactating women. Metformin has been known to be safe for a very long time, and we know how the dosage and the side effects and everything. And I was shocked to see that the effect was actually better than the vaccine or at par with the vaccine. So these studies would come out. We will note these things. Kim says, I'm getting sleepy. Everybody's going to be getting sleepy. So with this, let's actually take a break now. We will have a walk, 7 a.m. Pacific time. I usually, if I remember, I usually post a Zoom link on our Discord, and then we talk, and we are on the phones, and we are all talking and walking. No medical advice, though, just talking, walking, trying to be healthy. So with this, thank you very much. Please don't forget Dr. Paul Merrick. And for Wednesday's Zoom calls, if you wanted to join me, please feel free for that. And I would see you next week. Bye for now.